Yeah, thank you, Dr. Heyer. And so, based on that and where we're going forward, the concerns we have is if you avoid close contact with individuals outside of your household. And this is not a new message. We've said this all along. We tried to do it with social circles, and people late in the summer and September imploded on that and went very casual. And the other thing that's very interesting when I'm talking to our health units, especially those when you hear like Toronto and others saying we're having difficulty keeping up on all the case contact management. That's not because they're not doing the case contact management well. The fact is that in the first wave, when they did case contact management, they had an average of 10 to 12 people that were contacts of the case. Now they say it's quite common to have 50 to 60 to 70, even up to 100 of a case. That's saying the last 5 to 7 days you were in close contact with. And my thinking is, I don't understand that. Why would you have that kind of thing? What did you not understand about our messaging? And we asked you to maintain those steps. And so you're adding to the burden and the workload to follow that up on there. Because if you're doing what you're doing properly, you can have your close contacts and people you know, stay to that, stick to that, and deal with that. Because in the end, if we have to contact you because of a case, we would like to do it in a timely fashion, get you tested, and have your turnaround time as quickly as possible. If we have all these cases to follow up on, it slows the whole thing down because then people can't recall, can you really call 50 or 70 people? You may say, well, I don't know. I talked to a whole bunch of people in an event. There's 40, 50 people there. I just can't recall. That's really irresponsible. You should be able to know who you're contacting with and what you were there for. And so I would like to say that people should be helping in this. We want to be Ontarians and doing this. Don't be part of the problem. Be part of the solution. Again, focus in on this and deal with that. Coming up to Thanksgiving weekend, it's going to be very critical. Our weekends in the past have been one of our problem sites. Seems like a long weekend. People think it's an idea to chill out and just get casual and do whatever you want. There's some ways you can be casual in one ways, but don't be casual with your social context, with your wearing your mask, with keeping your social distance, hand hygiene. If you're ill, stay home. If you don't need to go out, don't go out. Celebrate with your close household family members. That's not just not a nice suggestion. That's a reality test because we're seeing these numbers going. And if we don't get a handle on this, we're going to have to deal with more stringent measures. We don't want to face a lockdown. It was easy when we did our case contact management when we had no schools and it was lockdown, nothing open. Now we're saying on this second wave, as an Ontario population, by taking what we know what to do, when we know how to do it again and do it again, we can flatten, the term is this curve, because we can do it. It's up to you. But we have to do it we want to keep our schools open. We want to keep a lot of our retailers open, essential services open. We want to do that. We don't have a total lockdown. And you don't want a total lockdown. If we do things now, do it aggressively and do it focused on that, we can avoid that. Thanksgiving is a perfect time to focus on that. You can still have and celebrate. Celebrate with significance, but celebrate with care and with proper procedure. You can do that. Same as I always use the comparison. We used to always be strong on how to cook the turkey well. Invariably, we had people call us up later and everybody in the household's sick. I don't know what went wrong. And you interview them saying, you did what? You didn't prepare this? And said, well, I didn't think it was important. Now you have a whole family team sick and you had a group of people sick because you decided it wasn't important and didn't listen. So again, this is an important lesson to listen to as we deal with this Thanksgiving weekend because our time is limited to make a response to this without having super spreading. So in this time here, if you get a sense, there's some of a frustration because to me, the messaging has been said and said again. It's so clear, it's obvious, but we need everybody really focusing in on this time. And we can blame certain things in that, but it's those congregate settings where people are not being careful. If they did what they did and are supposed to do in those congregate settings, it's not a problem. But you find people's backyard gatherings, wherever they're doing things, don't wear the mask, talk to anyone you want, shake hands, be sloppy, don't follow the protocols. You're just asking for an issue to arise. So we want you to stay focused and keep on that action there. We have had recommendations made from our medical officers of health. I'm in continual consultation with them, especially the one of the three largest areas. We've had the communications from Dr. Davila and what she would like to do in her respective jurisdiction and responsibility. And our public health measures table has met and discussed and made recommendations to me. And I've also made those recommendations to the government, and they're now being considered. So we want to adhere to the measures and principles. I don't want a lockdown. I want the schools to stay open. I want the healthcare system to keep running functionally, because in the first wave, we didn't have a backlog of surgery and cases. We do now. It's really important. We have to keep that resource open and running well. I don't want more outbreaks in long-term care homes. We have to focus on those things. We learned things from the first wave. Let's stick to what we learned and do it well and do it again. So those are the overall messages. So with this Thanksgiving coming up, I would like to be thankful if we have a good, safe weekend.